With any surgical procedure, there are potential risks, and with a frenotomy, they are as follows. A child can be uncomfortable or be in a little bit of pain after the procedure, usually for 24 to 48 hours. During this time, the best thing you can do is feed your child frequently. They'll also really respond to skin, holding them tight and doing all the things you do at home when your baby is upset. The other thing that can be used are topical teething gels that are age appropriate for your child, or some Calpol or Nurofen, and we'll often do a weight in clinic just to check what would be the max dose that they could have. The second issue that can occur is bleeding. So once a mum and baby go home, there's a 1 in 300 chance that the baby will have a small drop of blood in the mouth or some oozing. What you do if this occurs is to stay calm, hold your baby and offer them a feed. Don't keep checking to see if there is oozing continuing, just like a nosebleed that will make it continue longer. Offer feed for a full 5 minutes, time it on your phone, then you can have a look. If there's still an ooze at that stage, then you do the same thing again. So feed for a full 5 minutes, then you can have a look and check. If there is still oozing after 10 minutes of good compression on the site, it is important to place a cotton roll on the underside of the tongue, being careful not to make sure that you're touching your baby's chin or interrupting their airway, and you bring them to the nearest doctor. The chance of this happening is less than 1 in 10,000, so it's quite rare, but it's important for you to know. One of the other potential risk factors is temporary refusal to latch. After the procedure, the baby's tongue moves in an entirely new way, and it can sometimes feel like you're going from step one again and working your way up, relearning how to feed. So although it's very stressful, it is always temporary. The best thing that you can do is to wear your baby and do lots of skin to skin. This will really encourage them to feed. For breastfeeding mums, laid back breastfeeding would really help, also taking your time, having time with your baby. But it is also a good idea just to look at the alternative methods of feeding your baby, so that in the event that this happens, you have a backup. This can be a bottle, but it does not always have to be a bottle. It could be a cup or a syringe feed or a spoon feed, and there are videos available on my website that describe all of these. I suggest that you pick one, practice it before you come down to us, and hopefully you won't need it, but it is there if you do. With any surgical procedure, there's a small chance of damage to the surrounding structures of the mouth, and these include muscle, arteries, veins and nerves in the area, but thankfully this is very rare. And the final potential risk factor with frenotomy is reattachment. We don't really know how often this occurs, but we estimate it somewhere between 3 and 5 or 7%. Reattachment is when the new tissue forms in a tight way. So the new tissue forms a new restriction for that child. And what you'll see is your baby will do well after the procedure, but will quickly revert back to the symptoms or the problems that they came in with. If this happens, it's important you contact me ASAP so that we can address this.